Good afternoon, everybody. Thank you for hopping on today. This is the Children's Hospital New Orleans ThriveKids Return to School Support Town Hall that we are putting on in partnership with the Department of Education. This will be our 12th session that we've had since the start of the pandemic, so it continues to be an honor that we get to get through this as a team and celebrate all of the hard work that the educational community is putting in to making a successful, progressive way through the pandemic. From Children's Hospital New Orleans, we have myself, Kimberly Buckingham. I'm the manager over ThriveKids, and we have Dr. Leron Finger, our Chief Quality Officer here at the hospital, who's our COVID-19 expert that many of you are familiar with. And we also have Patricia Hewan. She's our school nurse coordinator who interacts directly with several of our school partners for any clinical guidance. From the Department of Education, we will have Meredith McGovern hopping on shortly, and she'll be able to answer any operational questions that come up. Just a reminder that we do have additional town halls coming up after today. We're going to move forward with a bi-weekly cadence every other Wednesday for about an hour. You can register in advance for these webinars similarly as you did today. All you have to do is register once and it will populate your calendar, and we'll continue to record each session and post it to our websites. Just a heads up for any schools that are interested in sharing this information with their families, our Behavioral Health Center is teaming up with our parenting program to offer a town hall solely focused on families readjusting to virtual learning if there is any of that virtual / in-person fluctuation learning strategies taking place. The Department of Education continues to make their resources available on their website, including their guidelines, resources, and dynamic FAQ. And please feel free to reach out with any questions, comments, concerns at LDOE COVID-19 support at la.gov. Our resources directly from Children's Hospital New Orleans continue to be available to you. Our hotline 504-837-7760 is available 7 days a week for COVID-19 questions, as well as 24/7 for pediatric virtual visits. That's been a great resource for schools and families. I will say that this hotline is not a resource for vaccines just yet. We can offer insight on, if you have any symptoms or anything or reacting to a vaccine, be more than happy to offer medical guidance pertaining to an individual, but this is not a resource yet to find out about what vaccines are available near you or anything like that. We'll get to what coordinating vaccines will look like later in our discussion today, but I just want to make that clear since that's front of mind for so many individuals. Our COVID-19 support on our hotline involve, as I mentioned, medical guidance for individuals, virtual visits with a physician for both adults and the pediatric community, return to school screenings, at-home symptom monitoring, etc. On our website, we have all of our recorded town halls, signage for schools, our decision trees, informational flyers for parents, etc. So I'm going to transition over to Dr. Leron Finger and let him give us an update on COVID-19 and review our decision trees.
All right, thanks, Kimberly, and happy 2021 to everyone on the call. This year will be better at some point, even though it doesn't feel like it's better quite yet. It's important to just remember going back, we're about 310 days into this pandemic in Louisiana, and it is exciting that we're already talking about vaccine distribution. For those of you who have been involved in the medical world for a long time, it's an amazing feat, and it will get better at some point. We can't let down our guard. I think we need to continue to encourage our team members and our families and students that if you're sick, stay home. It's not worth the risk. All of you, I'm sure by this point, have navigated a situation that was almost certainly avoidable by when someone knowingly but unintentionally came onto your school campus when they were ill and subsequently was diagnosed with COVID-19. Continue to wear your mask and socially distance as much as you can, and continue to hand sanitize. Next slide, Kimberly. So we went over this in December. I do think after the holiday break, it's worth revisiting our school return to school algorithm. This is what to do with a symptomatic individual. Again, major changes here are not much. If you're sick, get evaluated by a healthcare provider or get a COVID test. Remember that healthcare provider does have the option to provide an alternate diagnosis and determine that a COVID-19 test isn't indicated, although many will advise to get a COVID-19 test. Again, I can't tell if the sniffles are COVID-19. I find it hard to believe that very many people can do that. If you get the COVID-19 test and it's negative, you simply stay home until your symptoms have improved and you're afebrile for 24 hours. If it's positive, follow the isolation criteria that are listed there. And again, return to school with the documentation per school policy. The one thing I would like to add, underneath the box that says get a COVID-19 test, there's a link to the updating about those COVID-19 tests. If an individual gets an antigen test and it's negative, they still need to get a molecular test to prove that they don't have COVID-19. A negative antigen test in a symptomatic individual is not conclusive for the fact that the child or adult does not have COVID-19. I know you guys have all been navigating this to some degree, but I think the testing opportunities and options are still continue to be different in different areas of the state. Next slide. And this is just what we updated before the holidays as a result of the CDC revised guidelines with options to decrease the quarantine. If you are declared a close contact, you quarantine, you can return to school after 14 days in quarantine. That's not in question. You do have the option to get a test at day 5 to 7, which is when we recommend that close contacts get tested. If that's negative, and the school, your local school, individual school or school district has given this as an option, there's an option to decrease the quarantine time to 7 days. However, between days 7 and 14, that individual still needs to follow mask wearing and social distancing for the entire duration of the 14-day quarantine period. If masking and social distancing cannot be maintained, we recommend utilization of the original 14-day quarantine period. If that test is not obtained at day 5 to 7, then you can return to school 10 days after being in quarantine with the same stipulation about continued masking and social distancing through the full 14 days. Obviously, if the COVID-19 test that you get at day 5 to 7 is positive, you flip back to the previous page and follow the symptomatic decision tree guidelines. Keep in mind, both these options to decrease the quarantine duration need to take in mind what local prevalence is and which will impact the potential likelihood that someone will develop COVID-19 7, 10, or 12 days after an exposure. That likelihood is higher when the local prevalence is higher, and it's lower when the prevalence is low. So right now, in all of Louisiana, prevalence is high. Many schools have gone to virtual-based learning across the state. So I know that this is a decision that we allow local school leadership to make. The schools that I have dialogued with, I think it's the easiest option out of these is to either stick to the 14 days, or I think returning to school after 10 days in quarantine is operationally far simpler than trying to navigate the testing options that are available between days 5 and 7 and having the school nurse have to track down the exact time and date of those tests. But again, that's an option we give for local leadership to be able to make. I'll pause there and see if Kimberly's got any questions that have come into the chat.
No, Dr. Finger, we haven't received any questions just yet. I want to remind everybody, please continue to enter those into our chat so we can incorporate that in our discussion and get them answered in real time. If we don't have an opportunity to get to them, which I don't foresee, but we'll make sure to circle back with Meredith and make sure those make it onto the dynamic FAQ on the LDOE site. So we'll move on from the decision tree and just really go straight into open Q&A. Before we start that conversation, I just want to welcome Meredith. I know she was able to hop on. Thanks for being here, Meredith.
Yeah, no problem. Sorry, I was a few minutes late. We'd just like to remind our schools to keep up the mitigation efforts that they're doing so that we can try to stay with an in-person learning option if at all possible. So I know every parish across the state is in the red zone right now, so I really think it's a unique opportunity for our schools to do the right thing and set the example for our community to follow when it comes to COVID mitigation efforts.
Okay. Well, I'll go ahead and start off, Dr. Finger, with a few questions we received earlier this week from several schools that have reached out. And there's a lot of questions around what vaccine availability looks like for school staff. Could you maybe explain what the tiered rollout looks like and what the estimated timelines around that availability look like?
Sure. I can give you my best guess, although none of this is written in stone. It continues to be a very fluid situation. In mid-December, the rollout of vaccines began to frontline healthcare providers, and that has continued through this week across the entire state. There's a combination of hospitals and pharmacies and other folks who are in charge of that distribution effort. In addition, the week of New Year's, the governor announced that we were moving into the next tier for community vaccination, which for the state of Louisiana includes, broadly speaking, individuals who are 70 or older, plus several smaller categories of individuals, which include people with kidney failure, people who are involved in medical practices in the community, but are not necessarily affiliated with a hospital per se, or also providing care to patients in some form or fashion. Patients or individuals who are sort of categorized as home health type of patients, and including their caregivers. So that does not mean anyone between ages 16 and 70 with any medical condition. It really means the classic home health type patient who is, non-ambulatory, and that's how I think of it, as a home health type of patient with a severe disease. That has begun across the state, but again, I wouldn't say it hasn't been smooth, but most of the vaccine providers found out that we were going to be involved with this the same time the community did. So have begun to ramp up those efforts over the last 10 to 12 days. And most individuals began that last week, although it's still a challenge getting vaccine doses out to the entire state. The way the allocation works broadly is the state finds out from the federal government how many vaccines we're going to get each week between Wednesday and Saturday. And then at that point, they notify all the vaccine sites across the state how many vaccine doses they're going to get. Literally, we don't have that much more advance notice, which, as you might imagine, makes it challenging to get patients scheduled in all of our community vaccination sites. That being said, I don't foresee moving to the next tier in the next week or two, although I could be surprised. In the next tier, school team members are included. So that's a wide number of people across the entire state. I know we've been doing estimates in our local greater metropolitan area of New Orleans for how many team members that might be. And remember, it's not just teachers, it's all team members who work at schools who will be included broadly in that next bucket. So I'll pause there, Kimberly, and see if there's any other questions that came in to the chat, or if you want me to continue on.
There was a question that came into the chat, but it's not on the topic of vaccines. So I just want to fit one more vaccine question in and we can transition off. And that's really just how you encourage schools to start thinking about vaccine distribution, access. Should they partner with the local community? Is there anything they need to do internally?
Yeah, I think the biggest thing, school leadership can do is begin preparing the list of team members on your campus who will want the vaccine. I can tell you, when I get a list from a school, I don't want to be responsible for calling those people and finding out if they want it. I want the list of people who want the vaccine. So I think that's something that local schools should own in collecting that. There's not going to be a one way to do this across the entire state. I think local school districts will determine the best methodology or best vaccine partner in their local area to help facilitate the administration of the vaccine to their school team members. And keep in mind, those local partners will be doing it at the same time that they're continuing to vaccinate the rest of the community. So just the fact that we're given the green light on day one doesn't mean every school team member from across the state of Louisiana gets the first dose of a shot the next day. And have to make sure our team understands that they will be in line, but this is going to be an equitable, ideally, process. So some people will get it the first day, some people will get it the 30th day. And there's, when you have resources that are not, dripping off of us, everyone should understand that at this point.
Meredith, I think this is a question for you to perhaps comment on, and that's really if school members start to get vaccinated, say they're above age 70 or they're a school nurse, they have access to that kind of resource in their community, is there any type of reporting that those school members need to do to their leadership, to the state, or anything like that?
Not at this time that I'm aware of. I imagine that's a discussion that we will begin having on how to collect information on how many of our team members have been vaccinated. But at this time, as Dr. Finger said, if they're compiling a list and you've already received it, that should probably be an option on that list so that the school leadership knows that you do not need it because you've already received it. But we do have a question that's come into us several times, Dr. Finger, about vaccines. Should they prioritize them in the order of create priority groups within school systems? So say K through 12 classroom teachers who we know their students are not always wearing a mask.
I think you would create, yes, I think that would create create a sense of inequity within your schools that is unnecessary and creates a sense of complexity that is unnecessary. I would recommend not trying to triage your small school, individual school population, and rather bucket them all together.
All right, it's great advice.
Thanks, Meredith. All right, so transitioning back to some questions in the chat now. Kimberly submitted one that said, if a positive individual is getting close to their 10th day of quarantine and is still symptomatic, at what point can they test to see if they're negative to return to school? I'm going to go back.
Yep, so I think, Kimberly, we're talking about, I assume you're meaning about isolation and not quarantine, so two slightly different words. So if they're in their 10th day of isolation, they still don't need a test to see if they're negative to return to school. We follow a time and symptom-based policy to allow the end of isolation. So their symptoms need to improve, and it needs to be 10 days and fever-free without medication for 24 hours. So it depends what the symptoms are. If it's just loss of taste and smell, that can persist for weeks to months. That won't keep them in isolation. If they're still febrile with a hacking cough, they stay in isolation. I've let some people back with a, what I would call a very intermittent hacking cough, like they have a dry cough a couple times a day. That's okay. But otherwise, those symptoms really need to be almost completely improved.
Great, thank you. And then another question from Erica says, for individuals who have tested positive and recovered from COVID-19, how long do they have to wait before they receive the vaccine?
It's a great question, Erica. So there's almost no complete contraindications to administration of the vaccine. If someone is in their active isolation period with COVID-19, we don't give the vaccine. After the isolation period is over, they're eligible to get the vaccine, but what we advise individuals is that they almost certainly have antibody protection innately for the next 90 days. So if vaccine is scarce in your area, which by the way it is, we would ask that they wait until 90 days afterwards. That being said, it's not a hard rule, and I can tell you there have been some team members at the hospital who are within that 90 days who we've administered it to, and there have been some who said, I'm fine to wait. So I think you have to, your vaccine provider will be able to help direct that. The only other thing that is would cause you to wait is if someone has received an monoclonal antibody infusion, for those mandate waiting until 90 days have passed. The concern is that the antibody infusion might unintentionally interfere with the vaccine and your body's response, and you won't mount an effective immune response. So if someone has received monoclonal antibody, they don't get the first dose until at least 90 days later.
Dr. Finger, is there any type of form that helps with pre-screening before getting the vaccine to identify information just like that?
Yeah, so I think, Marcia, you can use the CDC form, and each vaccine distribution site has their own questions that they will ask that include some of what I just said. Have you recently had COVID? What was the time frame? Did you get monoclonal antibody? Have you ever had an allergic reaction, et cetera? So each vaccine distribution site is in charge of doing that, just like you would for any other type of immunization.
Okay, thank you. And then some other general questions around just the vaccine process itself. We touched on this just a moment ago, but where can educators expect to even get a vaccine? And when that's available, will that information be provided to schools? And how will that communication process look like? Do you have any insight?
Yeah, Kimberly, I think it's going to be different in different areas across the state. When I've discussed this with Meredith and Ken in the past, I think the answer I've heard is that the local school leadership and school superintendents will need to be in dialogue with the vaccine providers in their area to understand the system that will work best for their educator population. I only know how we're doing it locally here. There can't really be a statewide effort on this because it's such disparate in the who is providing the vaccines across the entire state.
Real quick, Dr. Finger, are those conversations that our school system should already be reaching out and having with providers or maybe with their regional medical directors so that when we do get vaccine availability?
I would begin the conversations now. There might not be answers, but I can tell you, if I were someone being asked the question, the first thing I would say is get your list of internal folks now so that that is ready once we're ready to push the go button. I would also strongly encourage any team members that are above the age of 70 to get vaccinated now. The more people we can do now, the fewer people we'll have to do when we move into the next year.
Okay, great.
Dr. Finger, is there anything else that schools can do to be ready for the time when vaccinations are accessible in their community? An example of this question is, do schools need to anticipate vaccines being administered on site? Do schools need to go buy extra refrigerators? Or is there anything they need to do?
Certainly, I don't think schools need to go buy extra refrigerators. I don't think there's an expectation for that. If there is mobile vaccination teams that are deployed in your areas, I anticipate that team would come completely self-contained with the ability to store their vaccines until they are administered directly into folks' arms.
And do you think that educators will have to prove documentation of being, on school staff or anything like that whenever they do show up at a clinic that can administer the vaccine to them?
I think that it's a great question because there is a lot of concern about people trying to jump the line. I can tell you yes, so there's concern about that. I don't think, I'll just tell you how we're running it here at our local site. If someone ends up on the schedule, they don't get ID'd if they're under the age of 70 to see why they're coming right now. Someone on my team has made an internal decision that they meet one of the categories I just outlined for you. I suspect it would be the same for when we move to the school situation, that unless they're only doing a specific school at a specific vaccination site, which I don't know how it's going to be in everyone's local area, I can't imagine that we're going to ID people. But my example that I give is I'm going to call up School X and say, all right, you bring your 100 people now. I'm going to trust that that school leader is not going to bring 60 people who work at the school and 40 people who don't. There's just no way we can have oversight. And that being said, if they come with 100 people, we're going to vaccinate them. We're not going to check their school IDs when they come on site. I hope that answers the question.
Yes, thank you. So after someone receives the vaccine, what can they expect in regards to feeling symptoms or not, or returning to work?
Yep. So this vaccine, no matter which one you get of the two current that are available, Pfizer, Moderna, they both promote an immunologic response. The response is probably more robust after the second dose. A large amount of people have very mild symptoms, arm pain, a little bit of, fatigue, but about 10% of people, especially after the second dose, have mild to moderate systemic symptoms, which can include a low-grade fever, chills, and really feeling cruddy for about 12 to 24 hours. That being said, I think in the beginning, we tried to really stagger our hospital staff by when they could get this and try not to schedule them before they work 3 days in a row. I think that causes an operational nightmare, essentially. So I would just let people know you might feel cruddy for a day. We are not recommending a COVID-19 test on that first day, but if symptoms haven't resolved after 2 to 3 days, then we might test. But routinely, we're not testing the day after if you feel a little bit cruddy.
Sorry to talk over you. If someone feels sick the next day, are they contagious about anything? Can they get other people sick, or do they need to isolate?
No, it's not. They don't have active COVID-19. This is your own body's response, making antibodies, et cetera, to the prompting of the vaccine.
Okay, that's helpful. And then after you have the first of the 2 doses, in between the first and second dose, are you any less vulnerable to getting COVID-19? Do you need to stop taking any precautions?
Yeah, so once you get vaccinated, your life doesn't change at all, okay? Everything that we've been doing, you're gonna continue to do. It doesn't give you free rein to go to a bar unmasked and cavort with other maskless people. I would strongly encourage that you continue to mask when you're in public, socially distance, and hang out with your nuclear family. That's, I think it's not a green light to go and do whatever you want.
So what is different after you get the second dose of the vaccine?
The likelihood of you coming down with COVID-19 individually is exponentially decreased. That's what's different.
Can you still spread it?
The suspicion is no, but we don't know that definitively. But all the people who are smarter than me think that it will be very unlikely to spread it once you've been immunized.
Great, that's helpful, thank you. All right, everyone, I would encourage you to continue to get your questions in. We've got about a half an hour left, but if questions slow down, we can end early today. As mentioned, this recording will be posted on the website, so we'll get that up there as quickly as possible so you can review with your teams.
Kimberly, we did have a question come in asking if the proclamation issued yesterday extended the vision and hearing screening suspension, and it did. So I do want to clarify that all of the education policies and suspensions that are in the governor's proclamation are still in existence. So we have received several questions for that.
Dr. Finger, do you have any insight on when vaccines will be available for the pediatric community?
The Pfizer vaccine is approved for kids ages 16 and older. The Moderna vaccine is not approved for less than 18 years. So once we get to the next tier, that includes healthy individuals between ages 16 or older than 16, 17, and 18-year-olds can get it. The trials are underway for both of those vaccines right now in the 12 to 7, down to I think 12 years. I don't know when they'll move into the next phase of the EUA, which is the emergency use authorization down to age 12.
Okay, thank you. Here's another question. This is from Maggie. If an educator decides initially that they do not want to receive a vaccine and then later changes their mind, will they still be considered a priority recipient if at that point they're at a later part in the vaccine rollout?
I would say if it's moved to a next tier, you're rolling the dice and you're going to be put in the bucket with everyone else.
Great, thank you. And could you explain the differences between Pfizer and Moderna vaccines? Or is there any key differences that educators should be aware of? Do they need to advise?
Yeah, for the purposes of this phone call, no. I think they both act via messenger RNA technology, which essentially is really cool. Messenger RNA goes in the body and it tricks your body into making a protein that looks exactly like the protein on COVID-19. Once that protein circulates around, your body makes antibodies against that protein, so that in the future, if you do get COVID-19, your antibodies are already in place to attack it. So they both just create a slightly different, they just create that protein in a slightly different way. What's important for you guys to also know is they're not interchangeable. So if you get dose 1 of Pfizer, you need to get dose 2 of Pfizer. They're not interchangeable.
Could one individual technically get both vaccines, say 2 doses of each vaccine?
You could, you certainly don't need to do that. And that would not be helpful to eradicate this pandemic.
Okay, so we did have a long question come in. I'm going to do my best to explain this, Jewel, but if I get it wrong, please let me know.
And hold on, Kimberly, while you're answering that, you can't get symptoms such as loss of taste or smell, Tori, with that. If that's something you have within a day or two of the vaccine, you should get tested for COVID-19.
It's a great clarification, thank you. Okay, so the first half of Jewel's question goes like this. We have most students at school enter quarantine without symptoms because they had an off-campus exposure to a positive person. And if that student tests negative with a rapid test, when they begin their quarantine, do we need to know that they have a low enough viral load that we do not need to do contact tracing at school? If the student with an
Kimberly, let me just read it because I'm trying to read it.
Right.
Is that okay, everyone? We'll have a little bit of a pause here while we all read Jules' question.
That sounds good. Everyone get your other questions in while we're digesting.
So I've read it, Jewel, and I'm still unclear if I'm understanding it exactly. I don't know, Kimberly, if you can unmute Jewel and have Jewel explain it. Is that okay?
Sure, yeah, I can.
While we try and do that, I'll answer Marcia's questions. I don't know what to tell those people exactly. There's a lot of information on the internet about how these work. All we can do is dispel those rumors and conspiracy theories. That's just not how these vaccines work. I have found it very helpful when I go to talk to especially non-clinical team members on our healthcare team to explain to them that this is the safest vaccine, I think, at the end of the day that we'll ever have seen. It doesn't contain COVID-19. And the day it's available for my significant other and children to get it, they're going to sign up to get mine to get it. I think just being and transparent with those team members is helpful. We don't know, Susan, if this is going to be an annual vaccine yet or not, like the flu shot. I think it's too early to tell.
Okay, so I'm going to go ahead and give Principal Reuter an opportunity to talk so she can ask her question. Principal Jewel Reuter, can you go ahead and chime in and give us a little clarification on how best to answer this?
Thank you. We have most students at our school enter quarantine without symptoms. And so we get a pretty good story about where the point of contact was and knowing when that person's symptoms started, you know, because it's kind of a accordion there just a little bit. And so if taking the logic of if they have a negative test when they go into quarantine, again, if there's some suspicion maybe at all about maybe when the symptoms actually started, because it's not always that easy to know of the positive person they were in contact with. If that person going out in quarantine has a negative rapid test, then does that give some confidence to the viral load being low enough on that student entering quarantine that contact tracing at that point is not necessary?
Okay, I think I understand, but just to clarify, I think we're mixing, if you're entering quarantine, it means you're a close contact. So presumably you aren't having symptoms. Is that correct, Jewel?
Correct, but we have had a few that go out without any symptoms and test positive the next day.
Sure, because there's lots of kids who are asymptomatic.
Totally.
Yeah.
Right. And I think that's what we're trying to mitigate against, having to quarantine, because if he tests positive the next day, I think we need to contact trace, right?
I think that's true. But again, let's just flip back to Kimberly, the algorithm. I think you're trying to see how we can stay one step ahead the algorithm with teenagers and younger kids. I don't know what school age you're in charge of.
3-year-olds to 7th grade. With 3-year-olds in particular, I mean, if they're not fully masked all the time,
Yeah, for sure. I will say, I think for the trying to stick to this and I don't think you need to get all those kids, if they're asymptomatic, tested that first day. Because if they're asymptomatic, I think, and they're declared a close contact, it's not going to be that helpful. Once in a while, you're right, you'll find someone who's positive. But if you look at it from a sort of public health standpoint, there's not going to be a lot of yield in that. So I think waiting until the day 5 to 7, presumably the vast majority of those asymptomatics, especially in that age group, Jewel, are not going to have a real high viral load that are going to spread in the class. Although we have seen some spread in that age group across the state, it's exponentially lower than the household spread from an adult caregiver to that child at home.
Well, and then what happens then, I guess, sometimes is that if you protect the anonymity of a student who goes out in quarantine, right?
Yep.
And then so you have one that's been out in quarantine, let's say 3 or 4 days, let's say if they turn positive, right? But the day before you've quarantined somebody, right? And communications go out to the community in a way that, again, exactly, tracking that. Naturally, what's happened on our campus, some of the families, especially large families, so I have 3 children, 4 children, they've naturally wanted to get testing done sooner than later to know what the condition of the folks in the family are, to mitigate in their way. The original logic of it was that they, thought they were saving some of the quarantine time, knowing if they're positive or not up front. So
yeah, I think that's what. Yeah, I think it's a challenging thing for you to have to navigate. But unfortunately, even with that, it's going to be hard to carve off the quarantine. And I think
because they're positive, though, that they go into a 10-day. It's just clear cut. Yeah, right.
Yeah, I mean, you can do that, but I would still say that test, if it's negative, they'll still have to retest at day 5 to 7 to give that added benefit of knowledge, if that makes sense.
And we're sticking with the 14-day, and we have seen a reasonable number of positive tests, day 7 and 8, actually, so.
Well, Jewel, thank you for saying that, because that makes what I said earlier even more prominent. I know I've had a lot of school leaders who want to go down to that day 7, but it doesn't mean that you're past the grace period. All right. Well, thank you. I'm glad we got to your answer.
Appreciate it. Thank you much.
Thank you, Joel. Appreciate you. Feel free to shoot us an email if you have any more questions. All right, we've got another question in the chat box, and this just goes back to operational implementation. A lot of our questions that we had late last summer really was wondering how we should sanitize school environments. And this one specifically regards to playground equipment in between cohorts.
Yeah, I think it's a great question, Whitney. I think in my conversations with school leaders, we've really just gradually de-escalated some of that, and perhaps I can work with the operations team at ThriveKids to coordinate sort of updating some of that information. I think as you look at what's your bang for the buck, doing that every 30 minutes through the day is probably not a lot of bang for your buck, but doing it once or twice a day might be beneficial.
All right, it looks like we're getting to the end of our questions. So Dr. Finger, do you have any closing comments you want to make while anybody gets any last minute comments into the chat?
No, thank you. Thank you for your patience. Thank you for your dedication to the students and your team members. I don't know if all the team members recognize the magnitude of work that this group does behind the scenes to keep the schools functional. It's very much recognized by me and the team at Children's Hospital here. So I appreciate everything you're doing, and we will get those vaccines in you and your team members' arms at some point soon. So thank you. Keep up the great work.
Yes, thanks, Dr. Finger. And Ms. Kimberly Gothrow made a really nice comment. She said, what would we have done without you guys? Thank you so much. We couldn't do this without you. And I'll say, we couldn't do this without you. So thank you for tuning in and asking such great questions so we can get as much information out as possible to everyone. So feel free to follow up with us at ThriveKids at lcmchealth.org. We've also got the Department of Education's email address up here as well. That's LDOE COVID-19 support at la.gov. And we're here for all of you. Thank you for absolutely everything that we're doing. And we'll get through this. Have a good day.